Welcome to another episode of It's Okay with Tam Tam. This is our third episode, and today we're going to be talking about the emotional side of breast cancer. So I have not personally experienced breast cancer, but I've had my mother has had breast cancer scares, and I've had family members that have dealt with breast cancer. Today, I'm going to have the pleasure of having my neighbor and my friend on that has battled breast cancer, and she has been so gracious to be able to share her story with us. But before I get her on, I just want to do a couple of facts. So it says 1 in 3 women are diagnosed with breast cancer each year, which is extremely scary, which means that everybody that knows somebody that has had breast cancer or they personally have had breast cancer. Also, breast cancer is the second most common cancer after skin cancer. And there's over 3.8 million breast cancer survivors living in the US, which that's great that there's such a large number of survivors, but it's bad that there's so many people that are having to deal with breast cancer. I also looked up, there are several people that have battled breast cancer, celebrities that I didn't think about. But one thing, Christina Applegate was one, and that she was diagnosed at 36 years of age. So she was a star on Married with Children. I think that's the show with Ted Bundy. But she went in and she fought for an MRI because they kept saying that her breasts were fine, they were just dense, and she fought for an MRI. And when she got a breast MRI, that's when she was diagnosed. So just there's a plethora of women. Judy Bloom, which she does children's books, Kathy Bates, Wanda Sykes, Carly Simon, and it's just so many people. So please let me introduce again my neighbor Liz and my friend Liz Owens. She's going to talk about her side. We are both very nervous because I appreciate her being so open on here. So please welcome Miss Liz. There we go. Finally got you on.
Hi, Tamara. How are you doing?
I am good. Are you hearing me okay?
I am.
Good, good, good.
Yeah, thank you for having me.
Thank you for sharing, being willing to share your a story that's something that's very personal. Appreciate it. You look so cute.
Oh, thank
So when when I met Liz, we live in the same neighborhood, and it was I remember seeing the Facebook post that you had cancer, and I just felt so bad that you had to be dealing with this in this time. I had never met you before. I don't even think I've seen you. And I said, I got to do something. And I didn't know you. So got you a gift card to, and let you know that if there's anything you needed, we're here for you. And it just kind of stemmed from there. So kind of tell me when you got diagnosed, kind of like, let's start from the beginning.
Well, I had found a lump in my underarm, and I had already had an appointment with my doctor scheduled. And my doctor didn't think it was anything, but said she'd order additional testing. And that was in June of 2020. And after they did additional testing, I had then COVID was going on during that time. I was laid off from my job due to COVID, and then the test results came back in. They came back in. I remember on the 10th because it was the day before my 23rd wedding anniversary.
So what month was that?
I'm sorry, that was in June of
Okay.
2020. Yeah,
Okay.
that was June 10th of 2020. And I
Okay.
just hadn't thought about it in a while. So
I know it's like opening up new wounds, but I'm just hoping when someone hears your story that it gives them hope.
I hope so too. Um, yeah, and actually, so Tori was here with me. We both heard the news at the same time. And from that point, it was just a rush of a lot of doctor's appointments and multiple biopsies, a lot of doctor's appointments, different specialists. I felt kind of like a professional patient for a while. And it was probably better for me at that time that I wasn't working because it just would have been really hard to get all the treatment. Everybody's breast cancer is so different and their order of treatment is different. For me, first I received chemotherapy, and then after chemotherapy, um, I had a double mastectomy.
Well, first, what did they tell you what stage and what cuz there's just so much like what type of it was. But did they give you that in the beginning? Did you know?
Well, it's interesting you asked that. So, in that first phone call, it was from a pathologist, and he told me, "You have stage 2 breast cancer." So, I thought, I have stage 2 breast cancer. And then it wasn't until I read my oncologist notes that I found out I had stage 3B cancer. And so I called the doctor's office to get more information. And they said that no, you have grade 2 and it's stage 3B. So it had metastasized to my underarm, and they did additional testing to make sure it hadn't metastasized anywhere else because breast cancer goes, I guess typically it can go to the brain, the liver, or the lungs. So those are areas they watch out for in particular with PET scans and CT scans.
When and which breast was it?
Well, it was the right breast. The left breast never showed positive, but I didn't take that to be true. I was worried that it was there, even though the test said that it wasn't. So I was 44 when I was diagnosed, and I had had 4 previous mammograms, and they said, "Oh, you have dense breast tissue," but they still, even the day that I came in and they did the other test biopsying the area under my arm, they never saw it on my mammogram.
Which is scary because I myself do have dense breast tissue, and my mom has dense breast tissue, and we hear that, oh, you just have dense breast tissue. So that's kind of scary. Did you end up having an MRI?
Yes, and it showed up on the MRI. And they used the MRI to guide some of the biopsies that they did. So I mean, if I had had the knowledge, maybe if I had heard somebody else's stories, then I would have advocated for myself to get an MRI instead of just the mammogram.
Do you have anybody else in your family that has had breast cancer?
My mom's mom, so my maternal grandmother, had breast cancer, and I also have a cousin on my mother's side, on my father's side, who was diagnosed about a month before I was, and she's about a year younger than I am. And I also I've had a couple of aunts with breast cancer and also prostate cancer in my family. And when I had genetic testing, they did say that breast cancer and prostate cancer both run in families, tends to be genetic. So even the genetic counselor was predicting that I probably had gene mutation just because of how prevalent it was in my family. But all of the genes they tested me for, they were all negative.
Okay. Okay. So after you got diagnosed and you started treatment, how was that? It's basic, especially since you were in the middle of a pandemic.
It was rough. And I think that it depends on the hospital where you are, even within the Dallas area. Um, there were some hospitals that were still allowing people to come in, but where I was getting treatment, they wouldn't allow my husband to come with me. So I had to go in by myself, and that was really hard.
What did your treatment consist of?
I was trying to remember how many rounds, but I had two different types of chemotherapy, and that started so it was 5 months of chemo. The first type was called AC, and the second type was Taxol. And AC
I
was
remember.
every other week, and then Taxol was once a week for 10 weeks.
I'm trying to remember before. I think I remember you saying it was a very high number. I think it was like 12, 13. I don't know. I remember when you were telling me how many rounds of chemo you had to go through, and it was I can't remember, but it was very high. I was shocked. I don't know if it was like 12 or 13 or something like that. It
It
was
was
very high.
Yeah, I'm thinking it was 14. I think it was 4 of AC. It was definitely 10 of Taxol. And I'm surprised I don't remember the specific numbers, but it's kind of like a whirlwind of
Uh,
a lot of stuff going on. Yeah.
And then so when you were getting your chemo treatment, how long were you in the facility? How long was each treatment?
Well, each treatment, oh gosh. So you go in, and then there's a lot of time, so I would probably be there for a total of 5 hours, but I wasn't getting infused the whole time. So it was seeing the doctor and getting labs, and then waiting in line forever, to get before they would call me back. They would call me when they would have us all wait on the second floor, because the first floor, they didn't want people too close to each other at the time. And then they would page you or call you when it was your turn. But it was a really long wait. And then there's pre-meds, and the pre-meds usually take about 30 minutes. And those are things like your steroids, your anti-nausea medications. And then after those are on board, then there's wait time. Usually they're waiting for the pharmacy to send the meds. I think the actual infusion time was less than an hour. It's probably closer to 30 minutes. And then depending on the type of chemo, all the chemos have different side effects. So I think it was Taxol that can cause neuropathy in your hands and feet. So they gave me an ice bucket for my hands and an ice bucket for my feet. So the whole time the hands and the feet are in the ice bucket, and that's supposed to help prevent neuropathy. So, and also chewing on ice. So it was, yeah. I brought my phone and watched movies.
Yeah, I guess that's all you could do. I mean, that's that within itself. So you're there 5 hours. I know me personally, if I had to do something 5 hours like that, and I'm already stressed because I'm dealing with, something like cancer, and then I can't have anybody there to support me and be right there to hold my hand or sit there and give me words of encouragement. I mean, that has to be extremely like frustrating to um basically have to go through that because we're in the middle of a pandemic by yourself. I know your husband was home and know he supports you, but it's just like, well, I have to walk you to the door and then that's it. You're kind of on your own. I mean, that's 14 times or 15 or how many times that you've had to go by yourself. Um, when you are there, and so I assume because you said it was weight, so there's other people there. When you're getting the actual treatment, are you um within talking distance of somebody else who's going through treatment, or are you like in a room completely by yourself?
Well, sometimes I would be put in a room by myself, I think just because of chair availability, but they had different units of these fairly comfortable recliner chairs. They're infusion chairs. You could uh, turn on a little massager on the chair. So the chair is pretty comfortable. But as far as proximity of other people, sometimes they were full and sometimes they weren't. People weren't very talkative. I think my whole treatment, I probably got into casual conversations with people a couple of times. For the most part, people just didn't seem to feel very good. So they would have their earbuds in, or, I mean, every now and then there'd be a conversation, but not too much. I think the worst part is if I was coming in for a medication that was just like 15 minutes long and then the wait time was 2 hours, and having to keep going and saying, hey, why am I waiting 2 hours for a 15-minute infusion? But the sad thing is that there's so many people there. I'm sure they're overbooked. And I mean, as you mentioned earlier, I heard in your introduction about how many people and how prevalent breast cancer is. And it's just everybody has to wait their turn. There's just so many people needing treatment.
It's crazy. And my cousin, she finished her treatment. I don't know where she's at as far as um I guess she's cleared. I guess, after you've done all your treat, because she did chemo and radiation. I guess after that, the I don't know where she is as far as if she has a clean bill of sale right now or if, they're gonna have to do something else. I'm hoping that, everything is on the up and up. But I just I just can't even imagine because I'm just thinking about how, like, even just with the pandemic, when people were having when COVID first hit and people were having babies, like the dads couldn't go in there with their mom. So I can only imagine you having to repeat this because I think you were going weekly or every other week.
Initially, I was going every other week, and then I was every week for those last 10 weeks. But even when it was every other week, I usually had multiple other appointments going on, because when you're getting surgery, you have your medical oncologist that kind of guides the treatment, and then you have a surgical oncologist. And then, depending on what you choose to do, you have a plastic surgeon also. And then in my case, I actually also she had me see a hematology oncologist specialist, even though I didn't have a blood cancer, because I had a gene that made me more likely to clot. So I was also seeing him. And then, well, I tried to get in some other visits before chemo started, like an extra teeth cleaning, because I was afraid I don't know what's going to happen. Are my teeth going to fall out? How's my body going to react to this? And I think that's the scariest part, is just the not knowing what my reaction was going to be to the medicine. Um, and then of course having to be, the nurses were very nice, but it is difficult to not have your preferred support system with you, for
Yeah.
sure.
And so after your chemo and radiation, what was your next steps?
I waited 4 weeks in between my chemo and my double mastectomy, because you have to give about 4 weeks or so, and they check your blood to make sure your counts are at a healthy place for surgery. So yeah, I had the double mastectomy the last day of 2020.
And why did you choose the double mastectomy? Because it was only in one breast.
I did because I didn't trust what they were saying, just because I had previous mammograms that didn't show any results. So I just thought, to be on the safe side, I just want to go through all of this one time. I don't want to have to get any chemo again or any surgery. And it's a very personal decision. And I don't think there's anything wrong with anyone's choice. I hope that women feel like, and men, unfortunately, anybody can get breast cancer. But yeah, I hope that whatever someone's choice is, that they're able to make peace with their choice, because there really isn't. I hope they have confidence that this was the best decision that I had. When my surgical oncologist gave me the options, I just kept sitting there waiting for another option, because I thought, God, these options are terrible. And I was just sitting in the silence waiting for him to say, or we could do this. And of course, that didn't happen. And it just seems like that the treatment options are kind of barbaric, is how I was feeling, because it's very aggressive. And you have to treat it that way at this time, where science is now, and there's just not a lot of options. I mean, you can go flat. Maybe you can get a lumpectomy or a mastectomy. That's kind of surgical treatment options. So
When I was looking up the celebrities, Wanda Sykes, so she had left, coincidentally, left breast cancer as well, and she chose to go ahead and do the double mastectomy kind of the same way. She just was like, nope, I don't want to run the risk of having to go through all this again. Let me just um, go through that. And then I can't remember one of the celebrities who had breast cancer. She made a point to say basically what you were saying, like it's your choice, as far as you should have a say in your treatment. So not to say like you're trying to overstep the doctor, but to say, like, if these are my options, this is what I want, kind of thing, and not the doctor just choosing everything for you. And that, I can't remember which what lady it was, but she was a strong advocate for that. Um, so with that being said, do you feel like you're being heard when you're talking to the medical professionals? 'Cause I know I've been in situations where I felt like I was talking to a doctor and I was not being heard at all.
I've definitely had moments where I felt like I was being heard, or that some of my questions were dismissed. And a lot of times I was afraid that I would forget my questions. So I would bring my phone, and in my notes, I would just write things. And in between visits, I would just jot down questions. And so that I would remember to address them when I was seeing the doctor. Some of my doctors were fabulous, and then some of them were not. And I do remember my surgical oncologist giving some good advice right after I got my diagnosis. The first time I saw him, he said, people are going to love you in their own way, and some people are going to seem really weird. But I recommend just let them love you how they love you. And I think that's great advice, because I try not to take it personally. If friends that were close, sometimes you find that they're not close anymore. And people that you never thought really cared, that you thought was a more casual friendship, turns out to be like, hey, I'll take you to your appointments. I'm here for you. Are you okay? I had so many people checking on me. It was pretty amazing.
Yeah, I can. Well, I wouldn't have thought, but I guess that's just part of it where people just don't know how to react. I wouldn't have thought that, people that you were really close to that kind of, I'm sure, like know you well, that would kind of um, stray away, which is kind of sad. But I guess it goes back to how you're what the doctor was saying, that people can love you. They're going to love you the way they're going to love you, that they can love you. So it's probably something that they just couldn't handle, I assume. So after you went through that, you were going through your surgery. What else kind of happened?
Uh, Gosh, I had a really, I think most people do. With my surgery, that was probably the worst emotional experience and physical pain that I've been in. And I don't want to scare anyone when I say that. I just want to have an honest response to for my experience. Um, yeah, that was a really rough. I wouldn't wish it on anybody, and it isn't like a boob job. I think there's some misconceptions that people think, oh, it's like getting breast implants, but it's quite a bit different. It's a lot more painful. It's a amputation of the breast tissue, and I mean, it's not as horrible for me as it was for, as it will be for other people, but everybody is different. It was, my radiologist was telling me that between radiation, surgery, and chemo, most people say that chemo is the worst. For me, it was definitely the surgery was the worst, and then chemo, and radiation was not as bad. It was exhausting. I was really tired. But I didn't have the same, like there's no nausea or pain with it. I had some chemical burn, but it wasn't bad compared to everything else.
And remember, you had some complications with your surgery, which kind of kept me on pins and needles. But I remember that, and I'm sure between you and your husband, you guys were very um, stressed out at that time.
Absolutely. So the last procedure that I had was breast reconstruction this past October. And that one had unexpected complications. I'm doing great now from it. But yeah, they accidentally punctured. I had a puncture in my lung, or the pleura that's around the lung. After that, I had a blood clot, so I had to go back to the operating room. Then they overtreated the blood clot. It was bleeding too much, had to go back to the operating room. So it was supposed to be a 2-day, and then you go home procedure. I was in the hospital for a week and had 3 surgeries. And as horrible as that sounds, I have heard worse in the breast cancer forums with infection and different side effects. But I was glad I was at a place that they could handle everything quickly.
So when you were going through your chemo and stuff, how did you get through it emotionally, especially since you didn't have your support system in the room while you were getting your treatment, but he was at home? What kind of things did you do that you felt helped you to get through this? That's over a year. So like you had to deal with, between a diagnosis, your job loss, a pandemic, multiple surgeries, and treatment over a year. How did you get through it? What were some of the things that you did? And then, like, be honest, like, how did you have days where you just were just like, just beyond frustrated, just beyond even angry, like, why is this happening to me? Or just like, what were you dealing with?
Um, well, I think that one of the things that helped me cope in the very beginning was that I decided that I wasn't going to shut people out. And that's a tendency that I have to do. Oh, I love you, Debbie. um, I have the tendency to be introverted. So I thought, I decided that I was going to share my story on social media, which was something that was different for me. I also had a yoga practice before all this started, and I continued it as long as I could. But then there were times when I just couldn't um, do it anymore. But I think the biggest thing that has gotten me through it, in addition to a lot of prayer, is community. I mean, you were fabulous. I had an accountability buddy for walking all the time because I knew, they say to walk when you're getting chemo and you don't always feel like walking. But then if you have a buddy to go walk with you, and then of course my husband's been my biggest support through this whole thing. So I think having the accountability, and also, I mean, if you're going through something and you think, other people are seeing me go through this, then I want to give other people hope. I don't want people to see me and think, oh my God, that's just the saddest thing. I want them to feel inspired to go on when they have. Oh, I love you too, Angel. So sweet. But yeah, I think that's the biggest thing. And something I think that you had mentioned earlier that I forgot to mention. So the day after radiation, my husband had a heart attack. So that was something that we were dealing with. But, I think it really depends on perspective a lot. Like there absolutely are still days where I feel frustrated and angry, especially the days when I was on bed rest from surgery. Those are the hardest things because you can't move around and I can't distract myself with movement. And I'm such a mover and I love to move. So that's when I'm the most miserable.
You have to inform people. Yes, not only do you do yoga, but you also you dance. So people have to understand that you're a very active person. And then to say stop, that's on top of dealing with all that stuff. Like I assume that's part of your stress relief to dance or do yoga, and then to say, well, find something else to deal with your stress. That's tough. That's kind of how I was when they told me to stop walking when I was pregnant. I was like, oh my goodness.
Oh my
No.
God, you're so active. I know that's not.
But I enjoyed our walks.
I did too. That was awesome. I have happy memories whenever we drive by that area on the way home. I think, yeah,
And I think about too when so because of the pandemic, we were you couldn't do the breast cancer walk. So they were doing it kind of like a virtual thing. So it wasn't this October, wasn't 21, so it was 20 breast cancer, and that's when we had all that ice and snow, and that October we walked and it was so cold.
Oh my God, you and your husband and my husband were all so amazing. They went out with me and we had our own, so we put on, I had my my Race for the Cure t-shirt on. We had picked up t-shirts and then we just did our own walk.
Yeah.
That was pretty awesome.
So, and then what else? Is there anything else like you do besides doing the yoga? Well, I know you're a limit because once you have the surgery, you can't really bear weight on those muscles. You can't really, So, I mean, there's a lot of planks and balancing on the arms, so you had to stop that. And so, what else? Like those days, like when you were in the bed because you were on bed rest and you were frustrated. What did you do?
I did a lot of reading. I started. I got a Kindle, and I read more than I've ever read before. Things that were very light and easy to read that I could just speed through. A lot of solitaire, a lot of Netflix. So much Netflix. Yeah.
Oh yes, and I forgot that you have your Octobers are your scary movie month.
Yes. So Tori and I, for about 3 or 4
Tori is her
years,
husband.
yes, my husband Tori, for 3 or 4 years, because we're a fan of scary movies, we did scary movie marathon. So for the month of Halloween, we would do 31 scary movies in 31 days. But I did not do that when I was for that December in 2020 because I didn't want any negativity in the back of my head with all of that surgery and
So you try to keep a kind of very positive environment.
Yes, I did. I didn't watch things that could potentially show up in nightmares or yeah.
Yeah. I remember you had your treatment. I think it was your last treatment, your last chemo treatment, and I think you end up going to the hospital for something. No, it wasn't your last treatment. It was like like near the end of your chemo treatment, and you had gone to the hospital. I think you weren't feeling good. I think you got dehydrated or something. I couldn't remember. I remember Dom, my husband, was talking about it. And then after your last treatment, we were so excited. I said, your last chemo treatment, we're over one hurdle, like we're progressing along. And me and Dom were sitting, and the way our house is positioned, we saw the paramedics light. So we look out the window, and we're like, oh, they're coming in our neighborhood. And we're like, no, no, don't be Liz. Don't be Liz. Don't be Liz. So we get dressed, we run downstairs, and we come. When we see them, we go, and they're parked in front of your house. And we're like, oh no. And then when they were taking your husband out on the stretcher. I was like, oh my goodness, Liz does not need anything else. Please let Tori be okay. And we got through it. I shouldn't say we. You got through it. Like that's
It
that's
really is a we. It's been a whole community going through this journey with us through all of our stuff. And we're so grateful for everyone. It's been amazing. But yes, he had a heart attack unexpectedly that night. I'm sure the stress of taking care of me had something to do with it. And we've both gone through lifestyle changes, trying to eat healthier, trying not to stress eat because everybody loves to stress eat.
and it doesn't help to be going through this over the holidays right now when you have cookies and desserts and just food everywhere. Yeah,
Yeah.
it's can be challenging to make it through
Yeah.
the winter like that.
You
Um so were you part of any groups?
Oh, absolutely. That was another great support that I had. And on Facebook, there is an amazing number of groups that have different, that are specific to your situation. As I was like, oh, yes, that's what I want to say. It was great to see that at the bottom of the screen when I had a brain fart just now. But yes, and I looked up things like breast cancer support for women, and I looked up mastectomy support group, and the type of reconstruction I had is called a DIEP flap, DIEP flap, where they take your belly and make breast out of them. So each of those are great for me, but they also have, ones for people that have BRCA mutation, for people that want to go flat, for people that, for men that have breast cancer. So there's a lot of great resources out there, but I have my Facebook groups that I go on every week just to see how everybody's doing and to check in.
Have you felt like you've have developed friendships or with those people in the group?
It's kind of it's kind of anonymous in a way with the groups. Even though I'm sure well, I say that. I think, yeah, I have made a few Facebook friends where we connected as friends from the group. But everybody, regardless of how close they are, everybody's so supportive. And if you just say, hey, I need some prayer, or hey, I'm worried about this, or what was your experience? Because there are some things that you get the doctor's perspective, which is great. They're knowledgeable, and you get that science side, but then it's great to really see what people are going through, what their perspectives are, and even like, hey, what kind of silicone tape do you guys use for your scars? I mean, from something so minor like that to something major, like, hey, I mean, I've seen people pour their heart out that hey, I don't know if I'm going to live or not. And that, think very, we've all been faced with our own mortality. So those are some really intense feelings. You really I really needed that support. And the groups are huge. So you can probably be as close or far away as you need to be.
When you say huge, about like how many people are in the group? So it's not like a group of like 5 or 6.
No, it's not. Although there is a group that's specifically for DFW breast cancer, and I don't remember the exact name, but it's like DFW.
Oh, that might not be it then.
Oh, no. But that's a great one too. Cancer Support Texas. Um, they can help with a lot of resources or put you in the direction of resources.
And I remember we were talking one time because we were talking about when you had your surgery, and I'm like, well, you won't be able to push up to stand up and things like that. And I think you said there was somebody who had a recliner that you can sleep in that can help you. Was that something you got from one of the groups?
Yes. So it was actually somebody who she started the DFW breast cancer survivor page. And she just out of the kindness of her heart is an angel. And so she had the chair and she put the picture of it online and said, hey, if anybody wants to borrow this chair during their flap or their mastectomy, let me know. And I asked her, and she drove it out here to us.
Oh wow. Oh wow. That was really good.
Yeah, that was pretty awesome. So to pass the baton, so to speak, she let me know when another lady needed it. So Tori drove it out there to the next person. So, but
Well,
yeah,
that's
it's pretty cool.
good.
It's still
Yeah.
circulating out there. She's letting people use it that need it, and I think that's pretty amazing.
I think one of the things that does come up because we as women we are concerned about how we look. So how's it for you as far as between mastectomy and a the chemo with hair loss? So how did you manage the emotional side of dealing with both of those?
Oh my gosh. So my husband shaved his head in solidarity, which was pretty awesome. I was like, you don't have to do that. And he came downstairs bald before I had my appointment. And speaking of community, yeah, my hairdresser was amazing. She actually drove me to a place where I got a wig. And then also my insurance company paid for a wig. And it was because of I had heard someone say it in the support group that I found out that if you've got to get a prescription, or in my case with my insurance, I had to get a prescription for a cranial prosthesis is what they called it. And so but she had to wait until I was bald or mostly bald, and she gave me that, and I was able to go to where my insurance company directed me to, and they covered one of my wigs. So that was
That's pretty
it
good.
was nice to get a nice wig, and then you can have fun wigs that you can get for $10 on Amazon. But to have,
Yes, a nice.
something that's more expensive, that's out of budget, it's nice if find out your insurance will help you.
Yeah. You were using those when you started looking for work. Because
Yeah.
most of the time when I saw you when we were walking, if it wasn't cold, you just came as you were. But if it was cold, you would put on your hat or something because it was cold outside. But so most of the time you were natural. You're just kind of like come as I am kind of thing. So I guess you seem pretty comfortable with it. Just what it is.
Yeah, I think there's that initial shock at first, but then it just gets to be like, I'm over this. This is hot. And it makes my head hot, and I'm getting hot flashes. I had estrogen positive breast cancer, was the kind that I had. So they put me in menopause. So I get injections and pills to keep my estrogen levels down. So I do get these hot flashes can get intense. So I'm at that time, I'm like, yeah, the short hair works when your head is hot for sure.
Wow. Do you oh, I'm gonna put this one up. The living proof warrior cancer.
Oh yeah. So there is a lady named Trisha who has this organization that she started called Living Proof Cancer Warriors. And she was amazing. She was, I think, one of the first people that I talked to after my diagnosis. It was a friend on Facebook that said, hey, you should check this out. So I reached out to her. Never talked to her before, and she just listened to me. She was amazing, and she also shared her story with me. She's a breast cancer survivor, and so is her sister. But this is a great organization, and again, they have information on resources, and they can help you kind of guide through things, and then also are fabulous at listening to what you're going through.
Which is I know it's very important to listen to people, because dealing with something like, first of all, the C word. So like when my mom got diagnosed with cancer, although it wasn't breast cancer, just cancer, it's the initial shock and anger, especially because you and my mom both are, try to be healthy. She was doing yoga and doing I think it's called aerial yoga with the sheets. She's
Mhm.
doing that. And she's like, I got to have my vegetables, at least daily. And she has her fruits, and, and then you hear cancer, and it's like, you get angry, you get frustrated. Like, why? Other people are doing worse stuff, and they don't, but this one who's trying to do right and trying to live right, and this is what come in. So although I wasn't the one diagnosed with it, she was, and I myself was angry and mad and then frustrated, because it's like cancer really, to me, is just, there's no rhyme or reason. People get it. There's no real understanding of, well, if you do this, this, and this, you won't get it. It just doesn't seem feasible. So, um, just trying to deal with that. And then now, like, they're telling you, well, it's estrogen positive, so we're gonna have to put you into menopause, which means no children, and now you gotta deal with hot flashes. And it's like, you're in your early mid 40s, technically you got another 10 years before you would go into menopause on your own. It's just, all these changes, and just trying to keep it together. It's
You know, Tori and I were on this mission at first. We were just like, I'm like, why is this happening to me? And I tried to think it away. Like I guess I tried to like it was a puzzle for me to figure out, like I was like, what? There must be something. So I just kept thinking, because like you were saying, I mean, I had a really healthy lifestyle. I was teaching 5 fitness classes at the time outside of work. And I've always been a mover. So it wasn't from a lack of exercise. I mean, I had a fairly healthy diet. Um, and we even reached out to some, like there's a downtown group, because we used to live downtown. So we lived in a high rise for over 10 years. And we were thinking, well, maybe it was something in the building. Maybe it's environmental. Maybe it's with all this cancer in my family. Maybe it's genetic, and maybe it's this or that. But I mean, it's so, I guess it's frustrating, especially for somebody, with my personality type. I want to know things, and I want to understand. And I've always been such a thinker. And I just, I can't figure it out. I can't figure it out. And I think that's the hardest part, is not knowing what's next. They say that after you've been cancer free for 5 years, that it's not as likely to come back. So then there's like, well, I can't think about that all the time. And I have insomnia anyway from the hormone changes. And I wake up during the night, and then sometimes that does creep into my head. I'm like, well, what if especially in at the beginning of the journey, I did think about, well, do I need to make plans? Am I on my way out? And then I would say most of the time I just try to take everything a day at a time. I had so many appointments to go to. Like, okay, what appointments are this week? And yeah, and my husband was also, I forgot to mention that earlier. My husband was also laid off, like so many people. We were both laid off during COVID. And so it was great to both be together at home while we were going through this and some of the other things we had to go through. So I guess it just depends on perspective. I mean, especially because I've heard some horrible stories in the support group. I have heard people say, "Oh, my significant other of so many years left me because he said he couldn't deal with my breast cancer," or and I didn't have that. I had like the opposite. I'm very fortunate. I had the opposite reaction to chemo that most people have. I kept my appetite, and I gained a lot of weight because of the hormone changes and not exercising as much. But it's yeah, it is a lot. It's a lot. I mean, I didn't realize how much I put in my own identity as a woman by losing my hair, losing my, especially my breast. I mean, my hair, you know, it'll grow back, but feeling like the whole thing is, it's just a very vulnerable feeling process of not, I mean, having limited options and being like, you know, whatever I choose, it doesn't really feel like my choice. It's just the choice to live.
Yeah. Yeah. Did it so when you had the double mastectomy, I'm sure that was to see yourself with a double mastectomy, it was emotional. Did some of the I don't know how to say it. Did some of the negative emotions that you had when you first had your mastectomy kind of ease up once you got your reconstructive surgery of now I have breast again?
Absolutely. Oh my gosh. So for me, because I was going with reconstruction, some people choose to go flat, but because I was getting reconstruction, I they put in tissue expanders, which is like a really um, bad implant because it's temporary, so they don't make it. It's not comfortable. So I was so excited to get those out and to have that pain gone, that the pain of the reconstruction was not anything compared to what I had before. So again, I was really fortunate. But yes, it does, and I'm so excited. I'll get phase 2 of my reconstruction in about a week.
Oh
So
Jesus, in a week.
yes, it's
Oh,
already here. But I'll say that, you know, at first I couldn't, it was hard to even look at myself in the mirror right after. But I have so much love and support from my husband and from my community, my friends, but especially having that intimate support from my husband, it made it easier to accept myself, because I got nothing but love from him. And I just think that he's amazing. I think sometimes husbands and significant others, whoever your significant other is, I I think that it would be great if they had more support, if they had more therapy and support, because they're going through so much being a rock for the person they're helping take care of. That I just think yeah, I wish there were more programs for them.
I wonder. I know they have like caregiver support group because technically that's what your husband is. So I know they have caregiver support groups, but I don't know if they have one specifically for like something like breast cancer because I know they have them for like Alzheimer's and like something like where it's like they you like you're 24/7, like they can't even sleep without being watched kind of thing. So I'm wondering if they do have some the caregiver support group um for people that are going through just cancer period, or even breast cancer, but even just cancer period, especially since breast cancer is so prevalent, like, and it's you go in and the doctor says this, and this is a scientific portion, but there's emotional, like that so much that goes in it too, emotionally, like when you're dealing with something like that, especially since you and Tori been married 20 something years, right?
It'll be 25 years this year, and it was the day before the 23rd wedding anniversary that I was diagnosed.
Wow. So yeah, that's like, so I remember you said, so you got laid off, got the news, he got laid off, and you're dealing with all this. He can't come in the room to support you. He has to support you at home, and you still keep smiling.
Yeah, I mean, so there, yes, breast cancer is awful, and there's no sugarcoating that. But having that perspective of just acknowledging the support that was around me, it kept me feeling like I just needed to keep going forward. And I mean, I still have feelings about it. I still get upset sometimes, or I just have days that are, today is not going to be a day where I'm social, or today I'm just not going to exercise today. Things that we go through, however we cope. Everybody copes differently. And I, I I knew that about myself, that I was an emotional compartmentalizer. That throughout my life, like if I'm just somebody that keeps myself really busy, and then if I'm feeling something and it's not a good time for me to deal with it, then I just like store it away. So I think that probably a lot of that all came out with this emotional journey, a lot of tears, a lot of hugs too. So I definitely wasn't going through it by
Which
myself.
is another thing that's hard with the pandemic. So like you can hug your husband, but then it's like outside people, especially when you were going through chemo, because your immune system is a little lower. You can't really expose yourself to everybody. And then your support groups, I assume you were there on Facebook. So it's not like you're meeting, which would be a totally different atmosphere because you're in-person meeting, but you can't because of COVID. And so the COVID having cancer during COVID is another beast within itself because it limits kind of the interaction that goes on.
Definitely. People are gloved and masked, and you don't even get to see people's smiling faces when they're going by you. Even like the casual stuff everybody's so covered. So yes, I would say 99% of hugging was from Tori. But I was glad to have, and my dogs. I do have 2 great hugging dogs. But I still felt incredibly loved. So I was teaching yoga, and where I was teaching yoga, where this happened, the owner, she did a fundraiser for me on Facebook, and
Oh,
we
wow.
met the fundraising goal, and I couldn't believe it. I was like, oh my God. And sometimes that would make me start crying, because oh my God, all these people, this is so much love. I can't believe that, somebody would do all this for me, and some people don't even know me.
And it's great that your way of giving back is to share your story. So I'm happy that that you I didn't even know about the fundraiser. I'm happy that you were able to get that to kind of help out because of all the stuff that's been going on. So with that being said, we're going to get ready to close out, but I want you to kind of express whatever it is. Let's say if someone is coming behind you because breast cancer has not been we haven't gotten rid of breast cancer in our society. So somebody they may be coming up behind you, what advice would you give them that may help them get through the stuff that they're going through? Not the medical side, that's what the doctors do, the emotional, the feelings. What is it that will help them and let them know it's going to be okay?
I would find your community. Our community, all of the neighbors have been amazing. There's Facebook support. There's counselors that are specifically for, like some that only treat cancer patients. So I would explore your resources. Don't be afraid to be honest, because everybody is, you mentioned earlier, everybody has been affected or knows somebody affected. I don't feel like I went through this journey by myself. I feel like there were people that definitely went through this with me, and I hope that other people have that experience, that they don't feel alone.
And that's very, very important because I'm sure somebody out there feels that they are alone and they're having to go through this alone. So, my goal again with this show is to whatever situation somebody is going through, that they can hear somebody's story and do what they need to do so they're not just so they do not have that feeling of being alone. So, this is our episode. Liz, I want to thank you so, so much for sharing your story and being vulnerable with us. And I found out some new stuff too. We're going to close out today, and I'm going to put on the screen some of the resources that Liz shared with me. Please don't mind the color. I try to do pink, but my system didn't really like me. So, anyway, so anyway, I wanted you guys to have a great day, and hopefully somebody has gotten out something out of this that can help them. Next time, bye.
Thank you so much.
You're welcome.
Go.